Good afternoon, everyone. Good afternoon. Thank you so much for coming. If your friends are still somewhere else, please tell them to come. This is one of the best sessions in this summit. I'm sure at the end of the entire session, you will agree with me. So very special welcome to Beyond Health, Positioning Family Planning as a cornerstone of gender equity and social economic growth. FP 2030 is the largest global partnership focused solely on family planning. This singular focus allows us to bring together the widest possible range of partners across disciplines, sectors, situating family planning at the crossroad of the global health, development, gender equality agenda. And you would agree with me that that is why we are excited to be co-hosting this breakout session with Policy Innovation Center. We are also, as FP 2030, leading a new collective effort to highlight what family planning makes possible. This is healthy families, thriving communities, economic empowerment, and unlocking dreams. The Made Possible by FP campaign highlights how access to family planning allows girls to stay in school, parents to raise healthy children, women to land their dream jobs, and meaningfully participate in workforce. Family planning is often framed solely as a health intervention. And you would agree that once they mention family planning, methods, commodity comes to mind, but yet its transformative potential extends far beyond individuals' well-being. We need sharper messaging, new champions, broader voices, and a united platform that speaks to shared ambitions. And we also know that the current funding landscape for family planning has been constrained by narrow perspective on what family planning is and who is benefiting. The limited view contributes to perspective that funding for family planning is unnecessary or wasteful. And I would like to just take a pause and tell you a quick story. So this is me, Margaret, and I'm able to be here because God's grace, but also family planning made it possible for me. I have 2 boys. When I had my first child during COVID, he needed all the time, and I was in between, what next? But because I had access to family planning, I was able to give him all the attention that he needed, get back to work, support girls at internally displaced persons camp, and continue my career, and was able to space. 3 years is a good time, right? And today, I'm able to be here because I had access to family planning. As simple as that conversation was for me and my husband, I noticed and did observe that not everyone have such conversation or even can walk into a facility to have access to family planning. So today, we are reframing family planning not just as an opportunity to create awareness, but to also position it as a critical development tool that goes beyond individual benefits, strengthening the case for sustained investment and prioritization. And today, I'm so excited to welcome our chairperson, who I believe has given me the permission to kickstart. And the interesting part is Dr. Salma Ibrahim-Anas. Can we put our hands together for her? Who is the special advisor to the President on Health and the chair of the Presidential Advisory Council, that's PAC, Subcommittee on Health. She is also a member of FP 2030 board globally. Dr. Salma Ibrahim-Anas is a highly accomplished medical doctor and public health specialist with over 30 years of experience in health sector development. Her expertise spans sexual and reproductive health and rights, maternal, newborn, child, adolescent, and elderly health, nutrition, health promotion, and health system strengthening, with a particular emphasis on primary health care as the foundation for achieving universal health coverage and advancing the Sustainable Development Goals 2030. She has also played a key role in the design and delivery of health programs in both emergency and humanitarian setting. Over the course of her career, Dr. Anas has worked with both government institutions and leading international organizations. She is widely recognized for her leadership, innovation, and commitment to strengthen health systems. Please make welcome as she chairs this event with a very special remarks this afternoon, the special advisor to the President of the Federal Republic of Nigeria on health. Thank you so much, Ma, and it's so wonderful to have you.
Thank you so much, Margaret. Let me start first of all by saying a very good afternoon to everyone, the organizers, the participants that are here, and also the panelists. Good afternoon to you all. So as Margaret rightly introduced the topic, we're looking at family planning beyond health. It is a necessity for socio-economic development and also a necessity when we talk about gender equity. We can't have it without having family planning available to everyone, including men, but most especially women, adolescents, and girls. And it should be an integral part of our sexual reproductive health and what I call the RAMCA, reproductive, maternal, newborn, and child health. Without it, we cannot attain our quest for attainment of universal health care coverage, where we believe no one should be left behind. So I appreciate the organizers for inviting me to chair the session. And I look forward to the session. I'm sure it's going to give us a lot of insight into what family planning is exactly beyond health. Because most people have the misconception, even healthcare providers, that family planning is a health issue. So when they talk of family planning, it's easy to condemn it and say it's a woman's issue, even within the family and beyond the family. Nobody sees it beyond that. But family planning, it transcends beyond health. Because just like she mentioned by herself, she's standing here, Margaret, because of family planning. And majority of my sisters here, my daughters here, my friends, they're here, including all the men that are here because of family planning. So it's beyond health. Without family planning, we cannot achieve equity. Can you imagine a scenario if you look at the reproductive age group between, let's say, 15 to 49 years? It's almost 34 years. So even with the natural family planning due to lactational amenorrhea, that is if guaranteed, let's assume it's guaranteed, that is you breastfeed for 2 years nonstop. And then the lactational amenorrhea, you know, it's working effectively. It means you will have every 2 years, you will deliver a baby. So in 34 years, I'm not good in mathematics. How many babies will you deliver? I expect the digital design to tell us immediately. 17 children. Yes, I've seen a mother with 17 children. I've seen a mother with 15. I've seen with 13. But that has serious implications on their lives, on the lives of the children that they bring to the world, on the lives of their communities, on the overall socio-economic development of our country. So this is not what we desire in Nigeria. So as special advisor to the president, we have walked this through, and we have prioritized maternal health as a pillar in the realization of the renewed hope health agenda of the current administration. We cannot achieve health without, and any meaningful development without positioning family planning as an integral part of the journey. So as you all know, Nigeria remains committed to providing access to quality family planning services since 2012. Through the federal government, it has contributed to the basket funding being procured by UNFPA. And we also committed, even before 2030, the initial was 2020 as of that time. We went through that journey, and then we also continue and reiterated our commitment to 2030. And part of what we agreed for 2030 a few years ago is that every subnational government, because the commitment should not only come from the federal government, whatever is coming from the federal government is a catalytic support, to demonstrate it can work. And that has been sustained till today. But much more needs to be done at the subnational level. So what we committed that time was at least 1% of the health budget should be allocated to procurement of family planning commodity. And family planning commodity should not, family planning, when we advocate for it, we should not talk about it in isolation of health. We should talk about it across sectors, across all sectors of development. When you talk about women development, of course, you can't talk of equity without family planning. People call it spacing of the childbirth, spacing of healthy timing and spacing of pregnancy, whatever. The goal that we want to achieve is that women should be able to space. Women should be able to plan. Families should be able to plan so that we have a more productive society. So this has been the advocate, and we should look at it beyond orientation. Even when you talk of security today, I always want to relate it to the breakdown and lack of availability to family planning, because when you don't plan, I think there is nowhere that we don't plan. Whatever you want it to succeed, you must plan for it effectively and pursue the implementation. So within the small family unit, it doesn't work if we don't plan it. The planning begins from there, and you must plan and have choices in terms of how many children you want to have, when do you want to have the children, and all that. So this is very critical, but I must also mention that Nigeria has made a lot of progress, though we are not yet there from what we have seen. It has been a very slow progress. So maybe because we've been working around family planning within health sector. Now we want to break barriers and work across sectors. So possibly this will give us the desirable result that we want to see, because progress has not been so good. The recent NDHS has shown us that we are still at about 20%. That is all family planning, but less than that when you look at modern contraceptive commodities. So how do we break those barriers? I think those are issues that we need to talk about in this session to see what has worked, what has not worked. How do we increase financing of family planning? Because what we are at the moment is heavily supported and driven by donors. So this is not the way to go, because we have to begin to think out of the box. We have to begin to think of ownership, self-reliance, sustainability. We have to make family planning an integral part of our healthcare delivery, just like we program for other essential commodities. Today, I'm glad to mention that under the Federal Ministry of Health, I was fortunate to be the Director of Family Health, where we have ensured that family planning commodities is an integral part of essential drug commodities. It's on the essential drug list at the moment, and I think this is a progress. So more efforts at subnational level to secure. Some states have done well, and we must mention them. Like Lagos State, they've done well, they've sustained, and then some even states like Sokoto, about 8 or 10 states have done well because they have budgetary allocation for family planning that has been released through the basket funding. But we want much more to be done. Most states should also commit resources and ensure that family planning commodities are also procured. But what I have learned over the period, over the years of work that I have done in the space of family planning and the landscape, to say it in that way, is that there's a huge gap, because I recall as early as 2020 to 2002, there have been a lot of engagement through development partners, UNFPA, specifically, to rally a lot of religious leaders, do a lot of study tours, take them to countries that we share a lot of, cultures and beliefs and ways of doing things, but they are doing well when you look at their progress in family planning, and that also was closely associated to their development. So what has gone wrong in Nigeria, if you look at the look back at 20 years ago, you will find that we've not made much progress. So community participation, community empowerment. The communities must be well informed, they must own it, they must also drive it. So we came up with recently with a project that we have started doing in the high burden states in the country, where we have a high maternal death. And because we know that family planning is a game changer, automatically it reduces. If a woman is not exposed to pregnancy, she has no business dying from pregnancy-related causes or childbirth, not at all, because you are not pregnant. You only die when you are exposed to pregnancy. So what actually works? You know, family planning reduces from what we have seen, more than 30% is guaranteed life-saving. So we started engaging with community leaders, religious leaders, discussing the issue in a participatory manner, asking them, do you have maternal death? How many children in a community, the total fertility rate, and we have seen it's about 5 point something, but I can tell you that in the high burden states, it's about 8 and above, some 10, some above that. So trying to get them to come up with solutions, because nobody wants to see women dying. Nobody wants to see a woman in her reproductive life producing 17 children in her lifetime. It's not easy, no matter how rich you are. There are a lot of things that are involved in upbringing of a child. So we started these homegrown solutions for them. And they brought up the issues, because when you talk to them, they will say, oh, family planning is a foreign agenda. But it's not true. From my community, where I come from, a Muslim community, it's not a foreign agenda, it's our own agenda. And our great-grandparents have practiced this for a very long time, you know, and some unsuccessfully in majority of cases. So how do we bring them to bridge the gaps, to close the gaps, to increase the use of family planning, and then work across, as I said earlier, barriers to ensure that it is available everywhere? So we need to begin to build champions. We need to have new voices, not only voices of health workers, voices of a community leader, a woman leader in a community, a politician talking about family planning. You know, different people in the private sectors, not necessarily in the health industry. So that is the only way that people will pause and say, let's listen, this person is talking about family planning and is not a health provider. So I think it will make more impact, and we're beginning to see acceptance among the general population in communities with high burden maternal death, beginning to talk about family planning, especially the male involvement. You know, we need to empower them since they are the helm of affairs at the moment, and but we are still working very hard to ensure a gender balance, gender equity. There is no way Nigeria can succeed if we continue to work on one leg. And what I said, one leg is that male-dominated, male dominance, you know, in socio-economic development, in healthcare service delivery. We must work to ensure equity in positioning women as leaders, especially in the health sector. Because this is an industry that the services are mainly provided. Over 70% of services are provided by women. You know, looking at it across board, from primary health care, tertiary care, to secondary care to tertiary care, especially at the primary health care. Majority of healthcare providers at that level, almost 90-something%, are women and young people. And then when it comes to the leadership, even at that level, you find that less than 30% are led by women. So the equity issue discussion starts there. We need to deliberately create spaces for women to lead, you know, in that ecosystem. Because when they lead, they are better equipped, better informed. We know they have the hands-on experience in terms of what should be done to improve the health of women, what should be done to explore potentials for education, because if you have family planning access, you are better equipped. It opens opportunities for you for education. It opens opportunities for you for economic development and all that. So it's not a lecture. I'm just supposed to introduce the topic and then talk briefly about family planning. But it's doable. Nigeria is on a journey of that, and we have demonstrated in the last 2 years continuation of the federal government funding through the basket funding and other additional funding that are currently coming under the Ministry of Health through the National Primary Healthcare Agency, and also through the 𝗣VAC, which is the presidential initiative on unlocking the value chain. So those are areas we have dedicated, but we also need to do more in individuals, putting in resources. Much more needs to be done at subnational governance also, supporting family planning. Because most of these women are vulnerable, they are not well educated, they're not empowered, they don't have the purchasing power to purchase even family planning commodities. But at the same time, we are also looking out of the usual way of business to see how do we also shape the marketing for family planning beyond UNFPA. And these are also areas that government are thinking as options to reduce the prices of the commodities. At the same time also, we are considering local manufacture of family planning commodities in Nigeria. It's not beyond our capacities in Nigeria. I think it's doable, it's something we can pursue to see that local, because we have a huge population of consumers that we should actually leverage upon to see that we also locally produce commodities in Nigeria and also export those commodities to other African countries and neighboring countries. And that is the only way Nigeria can say we are self-reliant. We are not dependent on donors or donor-driven funding to provide family planning commodities. And we have a sustainable, plan and a journey to attain an equitable access to family planning commodities to all Nigerian women, girls, and also adolescents. So with this, I say thank you so much for the opportunity, and I look forward to the outcome of these discussions to shape the policy direction. Thank you so much.
Thank you so very much, ma'am. Yes, ma'am. Please, let's put our hands together again. So we would put on a video. Please, can you put that on? And while that is on, we would like to quickly just welcome our panelists today. I will start with Dr. Fejiro Nwoko. Please come have your seat as I quickly read through your bio. She's a medical doctor, a wife, mother, pastor, and global health executive. Dr. Fejiro wears many hats in reshaping Nigerian healthcare landscape and with extensive expertise in stakeholders management, strategic development. She serves as the managing director and CEO of the Nigerian Solidarity Support Fund. Can we put it up again for Dr. Fejiro? Okay, moving on next. I'm excited to welcome our dearly beloved Jemima Osunde, who is a Nigerian actress, a model, TV presenter, and licensed physiotherapist. She gained prominence for her role in Layla in the award-winning TV series MTV Sugar, and has since starred in several movies. For the film lovers, I'm sure you know her so well. She's a graduate of physiotherapy from the University of Lagos. Jemima combines a medical profession with a thriving career in Nollywood. Beyond acting, she is an entrepreneur and co-founder of Sana Beauty, a beauty brand launched in 2023. She's also known for advocacy on women's empowerment and authenticity. She continues to inspire a new generation of creatives in Nigeria and across Africa. Let's put our hands together again for Jemima. Let me welcome Ms. Rhoda Robinson. She's the founder and executive director of HACEY. She's an accomplished international development professional with more than 15 years expertise in designing and executing high-impact strategies and policy intervention in the field of gender equity, financial inclusion for women, RMNCAH, SRH for young people, digital innovation in health and social development. Let's put our hands together again for Rhoda. Last but not the least, Dr. Anas did mention while it's important for us to have male involvement, and even as we deliberately create spaces for women to lead, I'm excited to welcome Yusuf. Yusuf Nuhu is the senior lead advocacy and country engagement officer, senior lead rather, advocacy and country engagement at FP 2030 Northwest and Central Africa Hub, leading regional and country advocacy and partnership work in 32 countries in the region, and also the focal point in FP 2030 commitment-making countries. Please, let's put our hands together for Yusuf. Thank you so much. We've got just 20 more minutes to go, so I will dive very quickly into our questions. However, there is a video that would play for just 1 minute, 23 seconds. Let's take that, please.
Family planning is the silent driving force behind and advancements we enjoy today.
As a mother and a professional, I understand the importance of being able to plan for the future, and not just for myself, but for my family and the communities around me.
I've seen how family planning doesn't just change lives, it transforms entire societies. It has helped me to balance my family responsibilities and have a sustainable.
Invest in both my career and my children is a privilege, and I don't take that lightly at all. I'm working with FP 2030 to continue supporting the systems that help make that possible at a time that is urgent.
But as you join this campaign, I also want you to do at least two things. Retweet if you're on Twitter, join media platforms about what else family planning can do. The family planning is possible. And as they is choice. And women out there, there is so much more that you can do with your life if you choose family planning.
Raise your voice and share your story with me.
Okay, thank you so much. I will take it up from the last set of statements from our Executive Director, Dr. Salma. She said the opposite of poverty is choice. And what family planning helps you do is to make choices. And that also just takes me to Jemima, if you don't mind starting up for us. You know, I was trying to read through some of your work, and I did saw a quote that you did made, I think some months ago. You said your biggest fear in life is poverty. I can survive many things, but I can never survive poverty. How can family planning contribute to breaking intergenerational circles of poverty and inequality? What changes have you seen in your community when women, girls, men, and boys have access to family planning?
Thank you. Hello. Hi, everyone. Good afternoon. Thank you all for being here. Thank you for that question. Sometimes I post things and forget that people will see them. So I had written that, I had said it in a podcast, that poverty is one of the scariest things in the world. And it ties back to what you have said. Poverty takes away choice from people. I think poverty is one of the most dehumanizing things that anyone can experience. It shows you parts of yourself you probably did not know exist. I'm looking around now and I can say that none of us here is poor, the kind of poverty I'm describing. I'm talking of not knowing where your next meal is coming from. I'm going to reference a movie a series that's just come out because, of course, I work in film. How many people here have watched To Kill a Monkey? How did you feel after the first 2 episodes? I personally paused and had to say a prayer, like whatever in life that wants to make me live like that man, not know where his next meal is coming from, not be respected by anyone, your wife, your mother-in-law. Every day is a struggle. Just when it seems like something is going to change, you're taken right back to scratch. I watched it and I felt intense hatred for poverty. His life was really tough. You know, he got to the hospital, his wife had just had triplets, and they told him one had died because of some, complications. In the moment, what did he feel? Relief. He was happy. And that's because that's one less mouth to feed. Poverty is a canker worm, and I really honestly look forward to a time in our country where we will not have as many people having to deal with, that level of want, of need. Another part of something that hasn't been added to my bio yet, I've just graduated from the University of Suffolk in the United Kingdom, a master's in public health, because I'm extremely passionate about health, public health in Nigeria. But that's also because one of the things that poverty attacks is your life, your health. Nigeria, I don't know, this is me, going out of what you've said. Nigeria accounts for, I would say, 2.5% of the global population of people. But we account for a quarter, which is about 30% of maternal deaths in the world. about 82,000 women die every year from maternal and obstetric complications. And majority of those women fall below the poverty line. Many of the reasons that they end up dying are preventable. It's not rocket science. It's not something that science hasn't discovered. Very, very, very avoidable things. Things that can be treated, that can be prevented, things that people are dealing with every other day and surviving. But because they're poor, they're not able to access quality health. They're not able to get the medication that they need. They're not able. There are a lot of women in Nigeria that still don't get antenatal care in pregnancy. And it's just very wild because we shouldn't be having to deal with that. And that's why I say poverty is a big problem, because a lot of these women, or even just the world in general, the country in general, are suffering from things that are very, very avoidable if they had the money.
Thank you so much, Jemima. I really appreciate it. Let's put our hands together for her again. I'm just going to you. What does girls' participation, decision making cases, and maybe also setting influence planning the world. And just 3 minutes, please. Thank you.
Just said, if one is not, cannot die from maternity, cannot be affected by maternity, I see how spread impact to choose when to have children has. In a family that would have been able to conveniently cater to 2 children, a husband and a wife, and that family amount of life, you see that they start with as basic as sending to school, having 3 schools, health insurance, and as well. So when a woman is put in a position where she does not have that choice, choices that has is limited the amount of time she to spread taking care of her children, taking care of and then contributing or deciding what to do for you find lots of women at some points transitions into her choice. It transitions into for how much of an education she wants to pursue at the day, because she has to know those decisions. She cannot say I will 2 children would it can more than time in relationship, and those or with a partner. A lot of times in we say family planning is a key component of life planning, because to the you're going to get when you're going to start having. It's very difficult for you to determine what kind of career you're going to have, where to invest the resources, very limited resources that you have in developing yourself as a woman and even contributing to the family that you currently have, or your space, or your community as well. I hope I remember the. So through our program, exactly with people, because we have you or creating that sense of that see in yourself. I know the kind of planning of control that is good for my body, and I know the decisions I want to make going forward. We start working on HR just about health being available. It's about you understanding your rights and your agents to actually ask for that health, and provided that when it comes to your sexual and reproductive health. So running your as influencers, as surveyors, this is the media and the language, our Cornerstone association. So that language and helping them understand what it means for their own future, it makes for you to we are going and the available resources that they have.
Thank you so much, Rhoda. Again, let's put our hands together, please. Very important that women and girls are able to decide for themselves how many children they want to have and provide them with this information. And so I'll through as a health system strategist, what can you say regarding the levers that are most in family planning? And we don't see talking about it even beyond health. Opportunity for us to be able to create and make sure that he is left. Contact at the is an opportunity. So how do we make that women to have access, integrating it in the system, the health system? Thank you.
Yeah, it's interesting hearing the other speakers talk about this topic, and it's interesting about family planning out of health. I'm talking about eating, right? And there are other sectors in integrate. But as you were speaking about strengthening what's in the facility, so you back again. We really need to divorce ourselves from predisposition, which is health. So one so that can really work with us, and she mentioned how she was speaking the Ministry of Information. Thank God. Is it actor for both male and female? It's the Ministry of Information. Second, in the facility. Then that working for that will not in the facility. We learn it to the hospital. So the Ministry of way to target a lot of Nigerians. I'm sure that Nigerian has a radio, TV, or a mobile phone and access information. It's one. So two technologies. So in we making, I that in another country I want to mention. I'm still trying to get a visa. You have to be this. You know, the past were criteria to check statistics because you're trying to promote an agenda, right? And you had to fulfill. So we saw that it was beginning to bring out those movies where we are moving. Can we and not to really planning? Of course, I'm sure the Gen Zs will not messaging as speaking couples, as you're speaking about relationship, as the scene is about relationship, about love and all of that. Put something in there. Very so for movie. Can they get some ways we can integrate? Another that is very important is private sector, right? While we're talking about access and we're free, still we're talking about the facility with the list or the drug list. That's facility level. Beating ourselves to the 20% of the that goes into the facility. A lot of the sector, the people everywhere, right? Need to access where to be. If you just go to the POS, next year, where can you find a family planning method? To saying maybe the highest of the closest will be right. And how much do you think? Then I'm sure you're not even aware. In pharmacy, I saw someone. I was shocked to hear the price. Myself to what am I? We can work with the private to do generations that are going to be that is beyond the funding for services for those that are available with the fast-moving consumer goods are producing sachets, ready at the store next to.
Yeah.
That's two sectors. That
Thank you so much, Fejiro. Because to the blessed man amongst women, Yusuf would like you to write a role in partners, aligning committees, to dive into the region as well as accountability mechanisms. Again, and it's invisible.
Thank you very much, and I know your questions calling for 3 minutes. It's important to look at the financing landscape family planning, because that there will be no program especially most. In terms of funding, you had 3 bases. Before, during the FP 2020 era, 2020-24, and then before 2020, made deliberate to create the budgets and is decided coming to around 2018, and way towards 2024, we witnessed, a dip in terms of planning. Of course, COVID-19 in 5 stick assistance is gone. Reality is going to change. So in the past, I've been providing money for family and government through their and then on which is the biggest the pie from donor governments and other versus domestic assistance. That covers almost 70%. Why am I this forward is a whole lot has to change going forward. We need to prioritize domestic mobilization. Countries in family planning is in all the plans the pivot for national development. Why it forward, and if you're not to announce it in the coming years, also, we're going to see the importance of that talking financing facility as support initiatives like this in the Sahel, the demographic dividend, as well as women empowerment. For Nigeria, like in the it is important to prioritize domestic resource mobilization, funding for family planning, and Health and Ministry of Finance in ensuring that units are executed very well. Yeah. So, lastly, the accountability is really key. FP20, the backbones of this journey from 2030 is a strong accountability framework we have, and because we look at countries, but it's the entire partnership. FP20 years knows, but the same. So it's accountability between all partners that commit made and for between 2010.
Thank you. And my apologies for having to speed you up. You already have sticky. You can put down one word to mind or a phrase of what FP planning means. If you have, you can also, if you have for us, our panel leave us sugar too. I need to know. There's a lot happening. Are we committed to moving forward? And more like to say final words. I mean, it can't be your final word. So, in closing, come back. Yes. Rhoda, take it. Please to just put down one word.
Committed to ensure access to education. So we are going to partner with anyone who is willing to do the work as well, because you have to work out. You have to. So in agenda. So for us, we'll continue investing in young people to agency and to take decisions, develop them.
Hands together. Yes, Jemima, please.
So if you have sugar, no, but like she mentioned, it's very powerful tool. Example, the monkey has a worker, encouraging and telling her on panic or whatever. You can watch MTV Sugar with them. Something that yesterday to Mr. Clare was that parents that from having the conversation with their children about their sex, please have a conversation. Five each other for dinner. I really hope that doesn't happen. We'll make it our responsibility to attack this. Not a FMCPH organization that are set up to tackle this. I think like ability. The lady that cleans your house, for example, has 2 boys, and I told her, if you get pregnant again, you pay me for every. With the salary, I pay her good salary. You shouldn't be than that. Make it your responsibility. The people that around you, your person, the staff, people you that financially should not be able to afford more. It's about the child coming to suffer. It's about the quality they even get to live. That's one to feed. Let's make it our responsibility to buy condoms for our husband and contraceptive pills, and diapers and baby food. So please, everybody, let's make it collective, individual responsibility. Well, cool for our population in Nigeria.
Yeah. Thank you so much.
Okay, so for NSS, we have the youth campaign that is launched. Years on is launching next week, and this year is about sex education, the one-led communication, and so commitment in that we have a platform to mobilize youth, speak to other youth, important sex education, how to prevent it. That's what we are committed to doing. Also, them to say where they could get daily planning at no cost nationwide. That is a move. This is a campaign months, but it is an initiation, so we can continue living this falls 70% of our population. If with them, thank you.
Thank you so much, Dr. Fejiro. And Yusuf?
I have 2 personal, the other one. Last week, I home after about yeah, I do. He's help my blood so that I will professionally at 30 will continue to mobilize partners, country government, CS, private sector, everyone that needs family planning would want to make that choice when you have you do them. So that's my commitment.
And on this note, we big thanks to our parents. And truly, but responsibility, we should prioritize and we need to stop seeing family planning as a way of or time pregnancy, see it to transform. Family planning open doors to education, career growth, futures. How shaped you can put down. Thank you much. Please, and we'll take together for them again. From up? Oh, this. Okay. And stand the chance to win a gift. So there's a gift to be won. Scan the QR code. I think that has been distributed already on the screen by the research assistants, digital screen in the foyer. Research assistant, so very much. Thank you for coming. We should give you all a round for you. There's no give that to our booths. So much.